When I created 5 Wishes for use in Florida, I wasn't sure how people would respond. I didn't know if anybody'd even want it. So we did our big media announcement, and the next thing I know, tubs of mail poured into our office. All over Florida, people were asking for their copy of 5 Wishes, and that led to the development of the national document. And sure enough, millions of Americans asked for their copy of 5 Wishes too.
Millions and millions of Americans are using the 5 Wishes Advance Directive to talk about and plan for their end-of-life care. 5 Wishes is more than a document. It is a complete advanced care planning program that supports you, your healthcare team, and your family in having important conversations. People use 5 Wishes because it's written in simple, easy-to-understand language. It is a legally valid document once you fill it out and sign it. 5 Wishes helps your doctors and family know what your wishes are. It allows you to talk about your personal, spiritual, and emotional concerns, in addition to your medical choices. 5 Wishes was created by Aging with Dignity founder Jim Toohey, an attorney, former assistant to the president, and previous head of Florida's Health and Social Services Agency. He was legal counsel to Mother Teresa of Calcutta for 12 years until her death, and he spent years working as a volunteer in her home for the dying in the U.S.
Mother Teresa did what she could do to meet the medical needs of the people entrusted to her care, but she went beyond that. She knew that the greatest need of an individual was to love and to be loved, and so she accompanied the dying. She sat with them, she addressed their pain, she listened to them, she loved them.
Our modern medical technology is the envy of the world, but sometimes modern medicine doesn't know when to stop and only prolongs the dying process. It can be difficult and confusing for families and loved ones to feel prepared to make decisions about medical care at the end of life. 5 Wishes helps people feel prepared for these difficult decisions, and this is one of the reasons it has become so popular. With 5 Wishes, you're able to put in your own words what it is that you want or don't want. You talk about the things that matter to you. And if you have aging parents or grandparents, you'll find 5 Wishes helps you to be a source of support to them. When their wishes are known and put in writing, you can focus on what matters most and on cherishing the time you have. Talk with your doctor about your end-of-life care. Give your doctor a copy of your completed 5 Wishes so that your instructions are clearly understood. In this video, we'll walk through each of the 5 Wishes and offer guidance on how to complete it. Wish 1 deals with who makes healthcare decisions for you when you are unable to speak for yourself. Wish 2 discusses the kind of medical treatment you want or don't want. Wishes 3 through 5 are what make 5 Wishes different from all other living wills and advance directives. These speak to what's in your heart, how you want to be treated, and what you want your loved ones to know. There are complete instructions on how to sign, witness, and file your 5 Wishes. Let's get started. Wish 1, the person you want to make healthcare decisions for you when you can't make them for yourself. This is also known as a durable power of attorney for healthcare, or a healthcare agent. Once you fill out your 5 Wishes, this will grant legal authority to a person to act on your behalf when you're unable to make medical care decisions, whether it's for a temporary period of time or permanently. There are instructions for picking the right person to be your healthcare agent. Read those instructions carefully. They give you ideas about who might be the right person to choose. As we go forward in Wish 1, we see a list of things your healthcare agent can do for you. It starts with making choices about your medical care and goes on to other decisions your healthcare agent can make. If you see something you don't want your agent to be able to do, simply cross it out. If you'd like to add to or limit the powers that you're giving your healthcare agent, you can do that in the space on the page. There's space on the form to choose alternates in case the person you pick to be your healthcare agent is not available. There's also advice about what to do if you decide you want to have a different healthcare agent, or if you change your mind about having one at all. It's important that you talk to the person or people you want to name as your healthcare agent. Make sure they understand your choices, that they are willing, and that they feel they can carry out your wishes. They should be part of your 5 wishes conversations. You will always make your own healthcare decisions if you are able to communicate and understand the decisions to be made. Wish 1 only takes effect when you are too sick or hurt to communicate or make decisions. If you are unable to make your own decisions or speak for yourself, the person you choose to be your healthcare agent can help direct your care with your doctor. That's wish 1. It's as simple as that. Now let's turn to wish number 2, your wish for the kind of medical treatment you want or don't want. Wish 2 serves as a living will. It begins with general instructions to your caregiver and stresses the importance of managing pain and keeping you comfortable. Wish 2 then turns to the definition of life support treatment. This includes treatments that are commonly included in the definition used by most states. Read that definition carefully. There is space there for you to clarify the meaning of life support treatment to reflect your own personal or religious feelings and beliefs. For example, some people will specify that in certain situations they do not want artificially administered nutrition, called a feeding tube, to be considered life support treatment. These decisions are yours, based on your own beliefs and wishes about the kind of medical treatment you want or don't want in end-of-life situations. Under the section called In Case of an Emergency, you'll find information about Do Not Resuscitate orders. A Do Not Resuscitate order, or DNR, is different from 5 wishes. It only addresses resuscitation, and it needs to be signed by a physician. A DNR is not appropriate for someone who is healthy or does not have a terminal condition. Read that section carefully and talk to your doctor if you need to consider a DNR. Now that we have an understanding of what life support treatment means to you, we next turn to the 4 most common end-of-life scenarios. Wish 2 only takes effect when you have an end-of-life condition. A living will only takes effect when you will not recover. It is about end-of-life care. We begin with instructions for when you are close to death. Read this section carefully, and you will see that after we describe what it means to be close to death, you're given one of 3 choices. First, that you want to have life support treatment in that situation. Second, that you do not want life support treatment and that if it's been started, you'd like it stopped. And third, that you want life support treatment if your doctor believes that it's going to help, but if it's not going to help, you'd like it stopped. These are general instructions that can help guide your care. We then go to the next scenario, if you're in a coma and not expected to wake up or recover. Read that carefully, and again, you have the same 3 choices. Think about what you would want in that situation and check the appropriate box. The third scenario is permanent and severe brain damage where you're not expected to recover. After you read that section and the description of that condition, check one of the boxes that reflects the kind of treatment you want or don't want. And finally, in Wish 2, there is space for you to describe any other conditions under which you would not want to receive life support treatment. Some people leave this section blank. Others make very clear that there are certain situations not addressed above in which they do or do not want life support treatment. And of course, discuss Wish 2 with your healthcare agent and doctor so that you've clearly communicated your choices. After you've thought about and talked about Wish 2, you can explore the next section of 5 wishes, the 3 wishes that make 5 wishes so unique. Wish 3 talks about how comfortable you want to be. It gives you an opportunity to talk about what brings you physical comfort and the importance of managing pain and symptoms. Wish 3 lists several caring and comforting ideas to help you think about what would matter most and feel best to you. You can cross out anything you don't agree with and write in anything additional that you would want. We hear from so many people who tell us how having 5 wishes helped them cope with a loved one's death. Knowing and following the dying person's end-of-life wishes brought peace of mind and the satisfaction of knowing they were doing what the person wanted. We also get a lot of wonderful feedback about Wish 4, the wish that helps you communicate how you want to be treated when you're seriously ill. Wish 4 allows you to communicate to caregivers and to others, here's how I want to be treated, so that my God-given human dignity can be maintained. That matters to me. Wish 4 allows you to talk about your emotional and spiritual needs. You may want someone by your bedside praying for you, or praying with you. You may want your hand held. You may not want to be alone, particularly when death may be near. Read each of the items, cross out what you don't want, and write in the margins or on a separate piece of paper if you have other wishes that aren't listed. It's perfectly legal to attach those pages to your 5 wishes once you've filled it out. In Wish 4, you're saying, these are the things that matter to me, my heart, my soul. I want you to know these things matter to me. Now let's go to Wish 5. Wish 5 is my wish for what I want my loved ones to know. Like Wishes 3 and 4, this is unique to 5 wishes. Wish 5 helps you think about and communicate matters of the heart and soul, to talk about your love for your family members and friends and others. It helps you to talk about forgiveness. It gives you a chance to ask for forgiveness from those you may have hurt in your life, and it allows you to forgive others. People get really creative with Wish 5 because it gives them a chance to communicate. Here's what's on my heart. Here's what's in my mind. Here's what matters in my life. There's also space in Wish 5 to communicate some details about what you would want for your burial arrangements and to give guidance to family members and others about a memorial service, whether you want certain readings, certain songs during that service, even if you want one at all. This can help others make arrangements with a funeral home and plan with your wishes in mind. At the bottom is space to talk about organ donation and any other matters that we might call closure matters. It helps you cover all of your concerns so that if you're not able to communicate, you have something written down that tells others how you feel. It's truly one of the best things about 5 wishes. Once you talk to others about what matters most to you and fill out your 5 wishes, there's one more thing you need to do. You need to sign it and to make sure you follow the instructions in the Signing the 5 Wishes section of your booklet. You also need to make sure that your witnesses meet the requirements that are listed there. Your witnesses should see you sign the document in their presence. Follow the directions and fill out your name, fill out all the information with your address and phone number, and sign it in the presence of those 2 witnesses. Some people ask if your signature has to be notarized or not. Look at the box on the form that talks about notarization. Unless you live in one of those states, you do not need to have your signature notarized. If you do live in one of those states, you can find a notary through your bank or ask a friend. Once you've followed the instructions and signed your 5 wishes document in the presence of 2 witnesses, congratulations! You've now got a legal document in your hands. You are part of a growing number of Americans, over 40 million and counting, who've filled out 5 wishes. But there's something else you need to do that's important. You need to take this form and talk to family members, your healthcare agent, and your physician about what your wishes are. It's not enough to just fill out the form. Make copies of your completed form for your healthcare agent, your family and closest ones, and your doctor. Make sure everyone knows and understands your wishes. That will increase the likelihood that your wishes will be followed and you'll get the kind of care you want and deserve. After you've made copies of the form, fill out the wallet card and write down where your original 5 wishes is located so that if you have an accident or health crisis, someone can look at the card and see who your healthcare agent is and also where they can find your 5 wishes. please do not place your original 5 wishes in a safe deposit box. Keep it in a place where it is accessible, and make sure your healthcare agent knows where it is. That's it. You're all done. Congratulations for having the courage to fill out 5 wishes. It can be tough sometimes to confront these questions, but once you do it, you'll be glad you did. 5 wishes isn't just for yourself. It's for the people you care about the most. It's a gift to those who care about you, because it helps them know very clearly what it is that you want and how to take care of you. This gives everyone peace of mind. We hope that 5 wishes can be a light in difficult times, and that it continues to help ensure that human dignity is preserved near the end of life, and people receive the kind of care they want and deserve. Aging with Dignity offers additional 5 Wishes resources you may find helpful for your family. The Conversation Guide for Individuals and Families helps you introduce advanced care planning discussions with your loved ones. You learn how to document your choices and what to do after you've had the conversation. It also covers frequently asked questions about advanced care planning and 5 Wishes. For Catholic users of 5 Wishes, the Companion Guide, Finishing Life Faithfully. It summarizes current church guidance on end-of-life decision-making, and it's easy to understand and use. Voicing My Choices, an end-of-life planning guide for seriously ill adolescents and young adults that was developed through research conducted by the National Institutes of Health. It is available in English and Spanish. And My Wishes, the pediatric version of 5 Wishes for seriously ill children ages 3 through 11. It was developed by pediatric intensive care nurses at Central DuPage Hospital in Illinois. It also is available in English and Spanish. 5 Wishes also provides resources for clinicians and health professionals, including training programs, customized documents, digital integration, and consultative services. Go to the 5 Wishes store for information on packages we offer that help you bundle 5 Wishes products and save.